Welcome to the 6th webinar to the HFA PRI Project webinar series. The PRI Project, which stands for Patient-Centered Research for Innovation, Development, and Education, is part of HFA's project with the PCOR Institute. In this final webinar of the webinar series, we will recap some key concepts and themes that were presented in the last year. We will also discuss the top 10 research ideas that was contributed by community members in over the last couple of years and how we can move forward with these research ideas to engage all bleeding disorder stakeholders. Before we start, we will want to provide a funding acknowledgement. This presentation is funded through PCOR, Patient-Centered Outcome Research Institute for the Eugene Washington PCOR Engagement Award. We appreciate the support and funding to engage in this project. So let's talk about what the PRI project is. So in the late 2016, HFA applied for a PCOR Eugene Washington Engagement Award to assist members in the bleeding disorder community to build the foundation knowledge of patient-reported outcomes research. As I mentioned before, PRI stands for Patient-Centered Research for Innovation, Development, and Education project. It consists of a $250,000 contract from PCOR and to train all community stakeholders in PCOR and CER. And it's also an in-person involves in-person education sessions, webinars, and online education. The opportunities to engage with researchers and to discuss new projects with them is part of the main core of the main goal and core of the PRI project. So the goal of the PRI project was to provide training and education of bleeding disorder community to bleeding disorder community stakeholders in patient-centered reported outcomes research, which stands for PCOR, and then comparative effectiveness research, which also stands for CER. Our long-term objective is to accelerate the paradigm shift to patient-centered care, treatment, and research by training our stakeholders to participate in research in meaningful ways. Our hope is that the PRI project training will result in capable and confident lifelong PCOR and CER participants who have a positive impact on those with bleeding disorders. As I mentioned, the PRI project is part of the PCOR Institute. So PCOR, let's just go over what PCOR is. PCOR is the Patient-Centered Outcomes Research Initiative. PCOR was established to fund research that can help patients and those who care for them to make better informed decisions about the healthcare choices they face every day, guided by those who will use that information. PCOR includes providers, patients, and other healthcare stakeholders throughout the research process. So the resulting evidence will address their most important questions and concerns. The PCOR provides awards to encourage engagement of patients and other stakeholders in CER, just like this webinar. So additional information about PCOR. PCOR aims to make research findings more easily accessible to patients and providers and researchers. And one of the goals that they have is to produce understandable and useful research findings to patients and healthcare providers to make healthcare decisions, to advance the idea of shared decision-making. And also one of their goals is to provide easily read summary for patients and general public describing the results and their uses. Also one other thing that they have is also summary for clinicians and healthcare providers that highlights information useful for shared decision-making. Also providing tools for healthcare decision-making, also making peer-reviewed publications available to providers and patients. More information about PCOR and how they fund programs and awards can be found at their website, which is PCORI, PCORI.org, and you can find that information there. So from our first webinar, we really were reminded about the foundational concept of what is research. By definition, research is a systematic way to look into materials and sources to reach a conclusion to a question or a concept. So you ask, well, one woman asked, who really does research? So let's go over who actually does research. To be honest, you do. We all do. Right? We do it regularly. We conduct comparison based on results. We use our judgment to act accordingly. So some of the things could be simple as Colgate or toothpaste versus Crest. There could be things like ketchup brand? Do you prefer Hunt? Do you prefer Heinz? We do it every day. Often we believe research is mutually exclusive to science, but in reality, everyone engages in research activities on a daily basis. We do basic research through our reviews on items. We also try different brands, different things. And also, it's not just items. It could be exercise in terms of daily activities. Same can be said in terms of acute pain relief medication. We do research in some form all the time. When it comes to patient care, we simply formalize it with process and procedures. So then why is research important? Research is important to everyone, not simply for researchers or scientists. Depending on the role you have, your focus will be a little different as you look at things from different perspectives. For a healthcare provider, one question can be, which medication is most effective to treat different kinds of bleeding disorder? And then if you change the role as a patient and caregiver, a question that you may have with research is, with multiple treatment products available, should I consider making a change in product? Or how would my treatment change? And how do I know if I made the right decisions? These are simple questions that you may have. And then if you switch to a different role as someone, for example, like an insurer, research can possibly provide an answer to questions such as, is regularly scheduled use of factor to prevent and bleed better than to treat a bleed when it happens? Which is more effective and economical? Ultimately, each person's value of research really depends on who they are and what role they play. So then, now that we know that research is important, as a community member and a patient, we need to ask, why is it important to get involved? There are many different reasons because of personal values and experiences, but some simple facts remain. Researchers in general urgently need to understand that outcomes that are most important to patients, family, and caregivers. They also need to understand that multitude of treatment and therapeutic options exist and what works best for whom. And also, there's different unique challenges of the hemophilia community. Depending on what severity you are and what bleeding disorder specific you have, it's different. As someone with a bleeding disorder, it is important to remember that you are the expert. You live with your bleeding disorder and it affects you more than it affects another individual. Your voice and input have significant amount of value and weight. And if you understand the value you bring, you can better advise researchers on how to make research more meaningful to bleeding disorder patients, also directly to develop and shape research, such as acting as a principal investigator, a PI. So in the previous webinars, we addressed most common effects of engagement on partners. In particular, engagement can help establish new relationships. It can help improve health management and ultimately make a difference in the lives of others. There are two types of research that patient perspectives and voice are in the forefront, and we will review them in the next couple of slides. So let's start with what is comparative effectiveness research. The first concept of the CER is essentially a new name on a type of research that we have been doing for a long time. CER is designed to inform healthcare decisions by providing evidence on the effectiveness, the benefits, and the harms of different treatment options. An example would be, is factor A treatment better than factor B treatment? It depends. It really is just comparing two items, two treatments, two modalities. And then the other concept that was also reviewed in the previous webinar is, what is patient-centered outcome research, also known as PCOR? In essence, it is the type of research with the focus from the patient's reports and perspective. PCOR really does help people and their caregiver communicate and make informed healthcare decisions, allowing their voices to be heard and assessing the value of healthcare options. PCOR also puts the value in patients' words more so than a traditional research when you think of research. One important thing to note is that patient-centered outcome research also encourages and strongly engages patients to become partners in the research process. As a research partner, a patient can play a key role in all three phases in this slide. In terms of planning of the study, you can be playing a role where you can identify the research question or research topic. And then in the second phase, you can also be in where the conduct the study phase. Patient can help assist with the recruitment and retention of the project. And then lastly, dissemination of study results. Beginning with the planning for dissemination, you can provide knowledge on what's the best way to get the results out to the rest of the community. And to literally, patients and caregivers, when they act in this role and they're engaging in this part of the research, can play any part in this research process. But our current state of research is not in the ideal format. So what is wrong with our medical research? So this was, I believe, spoken to in depth in our webinar number 2 with Dr. Jack Westfall, which you can go back and look and watch the webinar if you would like. But ultimately, Dr. Westfall mentions a couple of things. So in our current state of medical research, the work that it needs to go into it's huge. It's a lot of time and money spent into it, because inventing a new medicine or a treatment is just only a starting point of making improving health for individual patients. And also, it's estimated about the average of 17 years for only 14% of new science discoveries to enter into day-to-day clinic practice. So the items that you see that are any kind of medication or practice or anything like that takes a long time to go through the research process and to regulation before it actually gets in the consumer's hands. And it also found that from Dr. Westfall's research is that only approximately 50% of recommended preventive care is actually being used for Americans. For example, he had given was that just over 50% of eligible Americans have received appropriate colorectal cancer screening. Additionally, there are a lot of detours and speed traps in terms of medical research. There's a lot of potholes that limit the movement of treatment from research to actually being to a patient. There's also, with looking at random control trials, clinical trials, there's a lot of limited external validity. There's also a diverse nature of primary care practice. There's difference between efficacy and effectiveness. So there's a lot of things that needs to be done to move the needle to make it more cohesive. So how does it look in the bleeding disorder community? Lots of studies have been done on hemophilia, and treatment guidelines are routinely updated and distributed. But fundamental questions about how to implement these recommendations in practice remain unsolved. So we ask the question, what is the right level of physical activity for my patient, or for me, or for my child, depending on what role you play? What is the risk and benefit of substituting biosimilars for biological agents? What are the outcomes? Patient wants to know if the benefit is worth the cost of taking another treatment or letting their child pay for it. With that said, in order for patient-centered outcome research to be effective, we need to engage patients. The question, the same question that Dr. Jack Westfall presented is, okay, what is the right patient, or right informed, just right participant? Some of the qualities are the participants engaged in research should be curious, know some basic health knowledge, maybe has experience as a patient, has the time, travel. There's quite a few qualities that needs to be the ideal patient. But ultimately, it's not a conclusive list, but it does help describe what it looks like to be an engaged participant and partner in PCOR research and PCOR and CER research. So now that you know why it's important to participate, so then let's answer another question. All right, so as patient and caregiver, why use the results of PCOR and CER? Why? Because be part of the solution. In many situations, there is no single right healthcare decision because choices about treatment, medical tests, health issues come with pros and cons. To be honest, shared decision making is especially important in these types of situations When there is more than one reasonable option, such as screening or a treatment decision, when no one option has a clear advantage, and also when the possible benefits and harms of each option affect patients differently. Ultimately, shared decision making really is a process in which clinicians and patients work together to make decisions and select tests and treatments and healthcare plans based on the clinical evidence that balance the risk and expected outcomes of patient preferences and values. So let's continue speaking in terms of why use the results of PCOR and CER. Ultimately, the use of PCOR and CER leads to shared decision making. Through PCOR and CER research, patients are more knowledgeable and better prepared for dialogue. It also helps patients understand as if you're a provider, what they're trying to do. Builds also, in terms of physician looking into this role, is build lasting and trusting relationships. Both physicians and patients are very satisfied if you have a mutually respectful and engaged process and discussion about needs. When patients participate in decision making and understand what they need, they are more likely to follow through. So if we understand the concept of this collaborative approach, we also need to look at how do we find the results. So there are a lot of places to learn about results of research, but we do need places where information is presented in practical terms. Is there a trusted site on an article for the article? Is the article missing citation, references to a link? How do I know if this author is a trustworthy individual? Does it sound right? Can you find other articles in the internet to find the resources? And does the article only showcase one side of an argument? So those are some questions that most individuals may encounter. And there are quite a few different places where you can find it. You can find places such as like Google Scholar, which is a freely accessible web-based search engine that could have indexes of full text or metadata for scholarly literature. There's PubMed Central. It is a free full-text archive of biomedical and life science journal literature with the NIH. There's also places such as Agency for Healthcare Research and Quality. There's the Effective Healthcare Program. They provide quality of healthcare by providing best available evidence and outcomes, benefits and harms, and appropriateness of drugs, devices, and healthcare services, and by helping healthcare professionals. So there is a slew of places where you can find it, but those are at least the Google Scholar, the PubMed, the Agency for Healthcare Research and Quality. Those are some of the ones that come to mind when you think about it. And then once you have access or if you find a place where you find an interesting article, that's only one step, okay? So the next step is to how do you get the answer to questions that you may have once you read an article. So research articles generally is written in a methodical way, and most people will end up having more questions than answers. But don't let that be a barrier to stop you. There are some basic steps to help get answers to your questions. So some of the key items or key steps that we recommend would be read the article. I would say write down your question, highlight passages that you have questions on, and you can try contacting the author directly. In articles, you can find that information usually at the beginning and the top of the article where the abstract is, or at the end. You can also talk to your provider, your healthcare provider. You can always contact your healthcare provider and say, hey, I saw this article on paper and I want to ask some questions. I want to understand maybe some of the key concepts that I'm having issues with. You can always send them the copy of the article, write down your questions, and even send them the questions you have beforehand and schedule a time and talk about it. Because if you ask questions, it's so important to ask the questions, because when you ask questions, it helps your provider to understand your issues, your concerns, and you may have a more meaningful conversation as well. So those are one of the first couple of webinars that was covered. So the last webinar before this one was presented by Drs. Amy Dunn and Peter Trask, who spoke about the incorporation of patient engagement within the research process in the treatment center setting and also the pharmaceutical research setting. And we'll go over some of the key concepts that was introduced. So in the last webinar, Dr. Amy Dunn from Nationwide Children's Hospital in Columbus, Ohio, spoke about the use of patient-centered outcome research approach to address quality improvement in healthcare and hemophilia. The focus was on the use of PCOR, or as Dr. Dunn calls it, QI, quality improvement to facilitate the transition of care from pediatric to adult care. So through the project, Dr. Dunn and her team was able to incorporate some patients' perspective in their program on transition. They were talking about increased patient knowledge of their bleeding disorder treatment needs from as a child who's a pediatric care transition to adult care. They also developed this transition program where, for example, one hospital may be only pediatric and the other hospital is transitioning to adult care, a better communication between the two hospitals, the two treatment centers, and also for the people involved, the patient, the family, to help transition that care. And also she mentioned about how the program had the use of patient perspective and voice help patients and providers develop better communication of what treatment needs are down the road. Dr. Dunn indicated that during the process to develop the quality improvement project, that the treatment staff and team sat down and actually looked in depth on truly what their goal is and what they want to accomplish. For Dr. Dunn and her team, their aim was knowledge during the transition from pediatric to adult care, and also that includes the knowledge about hemophilia, how much the patient can talk about what they have with their hemophilia or bleeding disorder to the next provider, and also about treatment of their understanding of the treatment and needs and so forth. Okay, and then for Dr. Dunn also reminded us for providers and research, the benefits to incorporating PCOR and CER or QI can be substantial. She noted that with the incorporation of QI or PCOR, same thing, it's the same concept. She noted that there was increased communication within their team, with families and patients, and with their adult program at Ohio State. They also noticed that there was a documented knowledge of baseline. They used understanding they asked questions before and after, and also using the QI for them allows for a focused education, and also for immediate resource sharing so that the patient can get the resource they need immediately. Okay, with the benefits in mind, we were also, at least in the provider setting, in the HC setting, we were also reminded about the barriers and what enables in capturing patient-reported outcomes in the real-world data. Dr. Trask from Genentech touched upon this in the last webinar with Dr. Dunn. Dr. Trask provided his input through his work to incorporate PCOR concept and research notes that research and notes that the time constraints can be one of the most understated barriers. Doctors at clinic may not necessarily have all the time to address patient-reported outcome measures within a visit. He also spoke about the limited training of doctors to understand and incorporate patient-reported outcome measures to their work. So there are various factors that can impede the process and the use of patient-reported outcomes in clinical settings. But there are ways to incorporate patient-reported outcomes. So Dr. Trask mentioned some of these. He mentioned that to do so, to incorporate patient-reported outcome in clinical practice, at least even for clinical practice or even research practice, is to include integration with clinical practice guidelines, having a system where they are automatically flagging clinical scores, report notes. Also, some other things that he touched upon is providing longitudinal interpretation of what signifies a clinically important difference in patient-reported outcome measure data, and also the use of more disease specific questions and symptom-specific questions, and also making simplifying scales for providers, for patients, so that it's easier to understand with verbal descriptors. Okay, so those are some of the topics that are just a short recap of what it is. Ideally, we would encourage you to go back to look at some of the previous webinars that were presented, the last previous 5 webinars that would go into all these details, all the slides, information in detail. Okay? So now that we have gone over with the highlights from the previous 5 webinars, so the next question we would ask is, what's next? So in the last several years, HFA has been collecting research ideas from community members to develop a working list of community-driven research priority lists. After reviewing hundreds of submissions, we have identified the top 10 research interests. So the first one that we've seen is inhibitors. And then women with bleeding disorders, quality of care, mental health, comorbidities, treatment selection, emerging therapies and treatment, transition to independence, which kind of highlights what Dr. Dunn and her project addressed, aging, joint health, that includes joint health disease and surgery, and some of those concerns. So these are really broad topics. Some of the questions that or topic or research ideas we have seen from these broad topics can be very, very, very simple and are very, very discrete. For example, for inhibitors, topic of inhibitors, some of the question was, how can we address inhibitor development and how to best treat it? And then for women with bleeding disorder, some of the questions are, or research topic is like, how can we get women get screened and get taken seriously? And then there was also like a question in terms of like, can we do into research and delve into the idea of what is the difference between a carrier and those that are getting diagnosed? What's the difference? And for quality of care, some of the questions we heard about was, am I getting the best care? Am I doing much better than so-and-so at different state, at different center, or different treatment, and so forth. And then we also receive a lot of research ideas and topics that relates to mental health, the talk about stress and depression and anxiety of living with bleeding disorder and so forth. So there's a wide range of different questions that we receive. To simplify things, we just put these top 10 research interests, and we continue to collect research ideas when people contact us or we hear about it in conversation. So there is definitely a lot of work to be done. But with this list, our next step is to work with the community members to better flesh out these ideas and these broad topics so that we can develop working research questions. HFA will work with to identify potential research partners to develop research projects so that we can address these top 10 research interests. So as we work on developing research projects, we have several opportunities right now for you to get involved. In terms of education, we have this webinar series that's available on our YouTube channel and available for you to review and to rewatch. We also have our HFA Learning Central. Our HFA Learning Central is a platform where you could take learning on the go. You can use it on your phone, you can use it at home, and it covers different research, the basic module and what is bleeding disorder, and also upcoming, we're going to have a module in terms of what is research, what is clinical trial, so that you can refresh on the knowledge on these items. And then if you want to be actively engaged, if you have a research question that's either within the top 10 research interests or you have a totally different research interest, we definitely encourage you to submit those research interests to us, and then we can continue to build the database. If you go to our website, hemophiliafed.org, and then go under patients engagement, patients and services, there should be a research page, and then you can just look for tell us your research interest, and just fill that out quickly and just simple, straightforward forms. And if you're really interested in getting really involved in research, sign up for the HFA Community Research Portal. Our research portal is a safe, secure location where you can engage in currently research survey that we have developed. We currently have 2, which is the Tell Us About You, just the basic information about who you are, what your research interest is, and so forth. And then we also have Choice 2.0. We launched Choice 2.0 earlier this year to continue our work for choice. If you don't know, Choice was one of our key projects that we've done in the last few years that address patients' quality of care, quality of life, and just understand what are some of the concerns or issues that the community is facing. Information for that, Choice 2.0, and some of the questions can also be found on our website. And coming soon, we'll be launching a gene therapy knowledge survey that's also available in the research portal, and that's to address some of the ongoing needs or interests into understanding what is gene therapy and what is the community's needs, and looking for gaps to develop educational resources and so forth. And if those items, the previous 3 items are not within what you want to do right now, but you do want to talk about it later on, we definitely want to invite you to contact our research team to discuss some of your interests. You can reach us at research@hemophiliafed.org. And I'm here, myself and my colleague Janet Chukka will be here to connect with you, to have a conversation that may address any of your needs. So after this webinar, if you would like to learn more, just give us a call, email us, and we would love to have a conversation with you. We appreciate your time for watching this webinar and looking forward to engage in future research projects with you. Hopefully you will also be part of our research team as a research partner. Thank you.